Now, of course, you're going to want to know how we stand in the marketplace. I think the best way to learn about that is to do a news research for Practice Fusion. CNNmoney.com just did a wonderful article where they compared us to eClinicalWorks, NextGen, and they really did go over our web-based model. They showed how the free price is the direction this technology is moving in. It's what needs to happen for providers to adopt this technology, and it really is creating a lot of buzz. In fact, a few weeks ago we did announce that in 2009 we grew 400%, which is, especially in this time, that's a tremendous number. It means we reached over the 25,000 user mark. That number today is actually closer to 30,000 users. A big part of that have been the new modules we've released. That includes third-party integration, billing solutions, and that has really brought in a lot more people who were not previously looking at EHR. In fact, if you do a search for free EHR, free EMR on Google or Yahoo, we're definitely going to be the ones that first pop up. And the reason that people are talking, which has been the predominant way that we've been spreading. People want to know, how come I haven't heard about you guys before? It's, we're not spending money on advertising right now. We're focusing all of our resources on adding functionality to the product. And so we've been spreading by word of mouth, kind of virally, being picked up by news agencies. Of course, the reason why, again, as we said, free licensing and hosting, free for all users in the practice. Everyone is given access to the account. There are no charges for even uploading your demographic information. This is done by a person at Practice Fusion. It's not an automatic process. We've not eliminated that. You upload a file, we will scrub it for duplicates. But again, this is a free service. And the reason why we're able to do that is because it's in our best interest to make sure you know how to use the product that you're using on a regular basis. Because again, that is our revenue model. The live trainings that we do. Now this includes everything from a brief introductory demonstration, kind of what we're talking about today, done over online in the webinar format, up to live training, an hour long in the application, making sure that we answer all of your questions, show you the modules in conjunction with one another in a workflow style so that by the end of the training, you're going to feel like you know how to use everything in there. Now moving forward, if you want some more information, we will just do more one-on-one live trainings for you. Again, we want to make sure that you are able to use the application on your own. We will provide the support, but really we're going to make sure that you understand. The training system tends to be really about 2 hours altogether, and you know how to use the system. After that, it would be just individual support calls when you come up with something in particular, but really after about 2 hours, you're going to understand how to use Practice Fusion in your office. Anytime that you have a technical question, it's Sunday night, you can email our support team. We check these constantly. We'll be able to review the question, get back to you within 24 hours, generally much quicker, with some detailed information, as well as the fact that as account managers, we are happy to talk to you about anything. Now the high-tech guarantee is also something that is actually pushing the move towards EHRs. Now this is actually meaningful for everybody. Whether or not you're pursuing the high-tech stimulus money, the fact is that the government is focusing on EHRs today. It's finally putting some focus on the healthcare community. They're trying to expand the technology to make sure that everyone can use it. And so really, this comes down to resources being allocated to your industry, which is great. If the government expects you to have an EHR, then that means that they're thinking about it, that they're coming up with solutions to go ahead and move forward with it. A few weeks ago, I attended a webinar with the Chief Medical Officer of Provider Support and Adoption, and at the Office of the National Coordinator. And he specifically said what keeps him up at night is thinking about how over 2/3 of practices are going to be able to adopt this EHR solution, when realistically, up to this point, the vendors out there have been focusing more on large groups or hospitals. We've all heard probably of Kaiser having one, and we're thinking, yeah, well, Kaiser, huge hospital group, of course they have one. How are we going to do it? How is my doctor going to be able to have that? He's an individual practitioner. How are these specialties going to be able to work together? The fact is, the government is working on that. They're in close contact with us because of the fact that this is our focus. We're moving towards the 2/3 of people out there who need to have another solution. So again, this is something that means something to every specialty, regardless if you're pursuing this or not. The government is working on it, which is always great for everyone. So we're going to go ahead and go into the application itself. This is just telling you that we're going to be taking questions momentarily. But I would like to show you guys a bit about how it works. So we'll go ahead and log into the application itself. Now, this is in fact the application. This is not a demo account. This is my account right here. Of course, I'm not a provider, so I'm not going to be putting real information here. So all this kind of PHI here, this is for my fake patients I've created here. But the way it works is that Practice Fusion allows you and your whole office staff to log into one secure program to run the entire practice. Now, what that means is, while you're visiting a patient, you can be online using Practice Fusion, and your office staff are scheduling appointments, logging in using their own username. All that information is synced, but you all have access from different locations. Perhaps one of your colleagues is at home, on vacation. You can then share information through the application itself. Again, part of the web-based model.
Actually, Derek,
Yeah.
you could stop briefly here and get a picture of who we have here, what type of practices we're
Yeah,
in. 'Cause
absolutely.
I know I'm a massage therapist right now. Later, I'll be an acupuncturist, probably solo practice. Merdad is another bodyworker in a different style. So why don't you go ahead and...
Yeah, that'd be great. It'd be a
Okay.
good time too.
Sure. My name is Merdad Figanasani, and I'm a muscle therapy practitioner in the area of pain management, chronic pain and tension. And basically what I do is try to stimulate the muscles one layer at a time to find the root cause and eliminate them for long term.
Anyone want to mention their specialty so I can maybe focus some of the information towards you?
Yeah, I'm Natalie Tan. I graduated here 2002, practiced acupuncturist and herbalist. I'm also a nurse at UCSF. They're very crazy in the UK. In the UK, this is, the computer charting. Take forever. Take about 3 hours for a nurse from bedside. We hated it. But anyway, just want to know more about this. But I think about that somehow. I think about it would be good to have like sit on a computer and then start charting the patient information.
Absolutely. Well, yeah, and I definitely like to show you some of the workflow, how that
Yeah,
works. for real
just
patients.
like pose and tongue, there's some graphic that can indicate that you can do that.
Sure thing. Absolutely. Absolutely. We'll show some today, and then moving forward, we have plenty of information for it. What's
I'm Pam Moulton. I'm an acupuncturist. I'm on the faculty here. I also work at the Haight-Ashbury Clinic, where I'm the lab manager. I'm a clinical lab scientist as well. And what has just been facing us in the last 6 months is the idea that we will be converting to EHRs. And the revolution for like even my lab job is that the whole county of San Francisco has just merged laboratory data between the general hospital, and that we all have access to every patient who is in any community clinic or any lab, and they've merged all of the Quest private lab data with a single one patient, blah, blah. So it's like it's growing so much in Western medicine that I'm just here to start thinking this way. I mean, I see applications of how great it could be in the lab where I work at the free clinic to be able to enter results and fuse results and look at long-term trends and how great that is. But then, I do, for some reason, also see patients 2 days a week in my private practice as an acupuncturist and have extreme, for what it's worth, but I'm extreme frustration managing my own records. Things get subpoenaed and I lose data, and I don't hire office help because I'm only there 2 days a week. I'm really busy teaching here. And the other thing is just, I imagine this is going to lead to help with electronic billing, because the frustration in private practice is these companies don't want to see an envelope with a stamp and a piece of paper bill anymore. We're at the bottom of the pile, we never get paid, we have to fight for it, and it's all got to be electronic. So I'm here to learn, I'm here to go. I mean, after 35 years of various things,
right? I mean,
I'm stepping into new rooms with computers, right?
and
Yeah.
trying to kind of see
On
how
many
this is going
levels.
to work for you.
Yeah,
We're-
on many levels.
Absolutely, it's definitely a new field, which is
Yeah.
exciting, but also you're going to want to make sure you're getting, some structured information to make sure that it's not just
How
overwhelming.
big of a practice are you interested in working with? I mean,
Well, it really is very scalable. Tell you the truth, our focus at this point has been the very small practices. We're talking one provider, maybe his or her son is doing the front desk, something like that.
Yeah.
And because
Yeah, just like it.
Yeah.
This is it.
At the same time, I've started using Practice Fusion, and when I logged in, you can set up practices in multiple locations, and each location can have multiple practitioners. So if you've got one practitioner that's working at 2 or 3 different locations, the system accommodates that, so it is very scalable.
Or you could have 30 providers doing different things and
Oh,
sharing
absolutely.
charts
Mhm.
with patients.
And
Yeah.
I'm glad that we talked about this, so now I'll know.
I have
Good
one
to
more
show,
quick
yeah.
thing I need to put out into the room because it came up. It's like, we are not in the Medicare system.
Mhm.
Medicare refuses to allow us to get a provider number, so how can we qualify for high-tech Medicare incentives when they won't even let us in the Medicare as acupuncturists? I just had that question. You keep talking about these $44,000 incentives,
Yeah.
and I can't get a Medicare provider,
Right.
Medicare provider number. That's maybe only for MDs,
You know,
maybe chiropractors.
Yeah, I had invited some other
I see.
practitioners as well,
Okay.
and so,
Yeah, you know, at,
Okay.
at this point, it is just kind of part of how the industry is developing, so we do like
Yeah.
to make sure that you know that we are aware of this, and also, it's kind of like I was saying is, even if a particular specialty does not necessarily pursue that stimulus, the fact is that what it is doing is allocating resources, revolutionizing the field, so that way, you're absolutely gonna see benefits despite. I would like to definitely address that, I'll keep that in mind
We'd
a
love
second.
to see those incentives, wouldn't we?
Well, absolutely, you
Caroline?
know, and in fact, our.
We would love to get involved in
But I
that.
have a
Yeah.
question
Yeah.
with that, and that is that even though we may not have a Medicare identifier yet, it's still going to require unique UPI,
Yeah,
unique provider, so
Yeah,
that might be a
yeah.
starting place, and, you know, if luck is with us within the next year and a half, 18 months,
it
we
could
may.
even, actually, if we jump in and do this stuff now,
That's
it would
what-
show that we're stepping up professionally and
actually-
are ready to actually
Absolutely.
be given the status that physicians have.
Well, you know, I think that, you know, UPINs, NPI, Medicare number, these are just numbers. It's not
Yeah.
something that is,
Yeah.
can't be done. This, of course, is speculation on my part, but, you know, our VP of Clinical Affairs, you know, works with various specialties who are trying to get in on this stimulus track.
Mhm.
And, you know, we have been hearing a lot of speculation in regards about how they're going to reformat this. So, you know, I would say that a move towards using the technology, you know, getting in line with the specialties
Yeah.
that are using it, would definitely be a step forward and make it easier. And the fact is, with the focus on healthcare in America right now, you know, this is all to benefit patients regarding various aspects of wellness. So, you know, patients start seeing the family practice to get, you know, some blood work done, and they start saying, hey, you know what, I want you to share this information with another medical provider who works specifically on, you know, my back problem right now, the muscles in my back. That's going to just bring everyone in together. The idea of health information technology is to bring providers together to help serve the patient more holistically. So this is something I definitely would keep an eye out, and I think that, again, moving forward, adopting the technology and adopting just in line with the rest of where the government's heading towards would absolutely put other specialties on the map.